afternoon to continue our work on the budget, which we will be wrapping up by noon tomorrow, if not before, whenever we get done. And if you'd like to watch as well as listen, you can go to legislature.maine.gov and look up the Committee Health and Human Services. And we are visible there. We have some folks who have joined us in the waiting room or potential attendees, and we'll be inviting them in as we go along. Certainly, Mr. Mann, Mr. Wiley, and Molly Bogart could join us for the early part of the conversation. All of this is recorded. All of this will stay on video and audio forever and ever. And for those reasons, I ask people to turn off their, to mute themselves if they would. And remind people that the chat box is only to keep the committee particulars going and not to have any real content in there. So why don't we introduce ourselves going around the horseshoe and starting with Representative Griffin.
Good afternoon. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Tuskegee.
This is a virtual horseshoe until we really meet. Representative Connor.
Good afternoon, Mr. Chair. My name is John Connor, and I represent House District 58, which is part of Lewiston.
I don't see Representative Craven yet. How about Representative Madigan? We're not hearing you, Representative Madigan. You're not muted, but we weren't hearing you very well.
Good afternoon, Becton.
That's better.
I don't know what to tell you. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Okay. Representative Zager.
Good afternoon. Thank you, Mr. Chair. Good afternoon, everyone. Sam Zager, honored to represent District 41 in Portland.
Representative Lemlin.
Good afternoon, everyone. My name is Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Senator Baldacci.
Hi, I'm Joe Baldacci. I represent District 9 in the State Senate, which is the city of Bangor and the town of Herm. Thank you.
Representative Perry.
Good afternoon. I'm Representative Perry, and I'm sorry my phone is ringing. I can't find it. But I represent House District 140, which is 9 communities along the St. Croix River.
As I didn't say in the introduction, please forgive us for some of our technical difficulties, which we're discovering as fast as we can. Okay, Representative Craven. Would you care to unmute yourself and join us?
Thank you, Mr. Chair. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Javner.
Good afternoon. I am Kathy Javner. I'm representative House District 141, which is located in Penobscot and Washington counties.
Thank you for that, Representative Perry. We had a good laugh. Senator Moore.
I've had to help her find her phone before by calling her, so I understand that. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan as well.
Representative Meyer.
Yes, it is so nice to see so many smiling faces. I am Representative Michelle Meyer, serving Southern Maine's House District 2, which is parts of South Berwick and Kittery and all of Elliott.
And I'm Ned Claxton. I'm honored to serve Senate District 20, which is Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. We're also joined by our notable staff members. Anna, do you want to introduce yourself?
Hi, I'm Anna Broom. I'm one of the legislative analysts for this committee, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And Aaron is here.
My name is Erin Dooling. I am also one of the nonpartisan staff for the committee and work in the same office as Anna.
Luke.
So good afternoon. I'm Luke Lazor. I work in the Nonpartisan Office of Fiscal and Program Review.
Our clerk is Carrie Withy.
Good afternoon. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
And as resources today, we're joined by, excuse me, Mr. Mann.
Good afternoon, committee members. Nice to see you again. My name is Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services.
And Ms. Bogart.
Good afternoon. I'm Molly Bogart, Director of Government Relations for DHHS.
And Mr. Wiley.
Good afternoon. I'm Jeff Wiley. I'm the Budget Director for the Department of Health and Human Services.
So our assignment today is to continue working on the budget. So I'm going to turn things over to Luke Lazur for our hopefully last walk through the green gospel. And we'll go from there.
So good afternoon. We will be starting today on page 17 of the green document. And we're starting at line 269. And as we've done on the other days, if you have a number of lines you want to vote all at once, just interrupt me at any time and do as you please. I'll just sort of walk along until I'm told otherwise. So line 269 is in the Maine Center for Disease Control and Prevention, and account 0143, and the Office of Maine Care Services account 0129. This establishes one public health nurse consultant position funded 25% general fund within the Maine Center for Disease Control and Prevention program, and 75% other special revenue funds in the Office of Maine Care Services program to oversee a mortality review committee for all home and community-based services waiver programs to ensure federal compliance, and provides funding for all other costs.
Yes, Representative Javner.
Thank you, Chair Claxton. I would make a motion to move lines 269 to 272 into the budget.
Thank you. Is there a second?
I'll second that motion.
Several seconds. Thank you. So Carrie, we're going to vote on lines 269 through 272.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes, sorry about that. Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
Yes, Representative Javner. Is your hand still up or you have another proposal? You need to unmute yourself.
You're on mute.
I said, I do have another proposal and it's your lucky day. I would like to move lines 290 to 305 into the budget.
290 to 305. Okay. Is there a
Senator,
second?
Ms. Broom has her hand up.
Right, but I have a motion and it needs a second first.
Sorry.
If I could. I heard a second. Yes. Thank you, Joe. Yes, Anna.
I can wait until after the vote if you like. It actually relates to the mortality review position in lines 269 and 270. So if you want to vote, you can come back to me.
Okay, why don't we go ahead and vote then, Carrie, and then we'll come back to Anna.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Sorry, yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Now we'll go back to Ms. Broom.
Okay, so I don't know what the department want to do about this, so they may want to weigh in on this. So when you have talked about the mortality review position before, there was a lot of language that went along with it. I know that I believe that we heard that Representative Madigan has a bill related to it too, but it's not, I don't know whether the department want to put that language into the budget now or not. This is establishing the actual review board that it would, that the position goes with.
Molly, do you want to jump in or?
Sure, sure. And I think we do want the language to become statute that we agreed to on LD 1377, I believe, last year. And that was a compromise between us and the stakeholders with the review board. But I completely defer to the committee about their preference, whether that is something that we present in a change package, or, I mean, the amendment, we reviewed the amendment that we agreed to last year and are fine with that. And so if the committee is also comfortable with that, we could, of course, at your discretion, add it now.
Representative Madigan, was that something you had planned to include in an amendment or not?
I didn't prepare an amendment for this,
Okay.
but I do have a bill into that. But it is the thing we had last year.
Okay. Any sense from the committee about how they'd like to proceed? I'm a little uncomfortable voting in something when we haven't seen the language. So
I could send it out today and you could talk about it tomorrow if that would be helpful.
let's add that to the list of language that for the review tomorrow. That sounds like a plan. Thank you. So who's going to bring the language? Are you and Anna going to work that out?
Yeah, I think it's an amendment that Anna drafted last year, and so I will make sure we're on the same page. But I imagine we are. And
okay,
I'll check in with Molly before I send it out.
All right. Okay, so that will come up tomorrow for consideration attached to that particular line item. So Luke, it's back to you.
Great. So we are now up to lines 306 and 307, which are both in the medical care payments to providers MAP account 0147. And this is just funding in order to claim enhanced expansion federal medical assistance percentage rates for biannual hospital supplemental payments.
Okay. And yes, Senator Moore.
I just want to confirm, I had written in my notes that this will not affect the hospitals in any way. Is that correct, Luke?
That's correct. Because all this is doing, getting some feedback.
I'm sorry.
All this is doing is changing where the funding comes from. It's moving some general fund dollars to federal expenditures fund.
Gotcha. Then I would make a motion.
Wait a minute. Senator Moore, you got muted.
Sorry.
There we go.
I just talking away. So in that case, then I would make the motion that we move 306 and 307 into the budget.
Second.
I'll second.
And there's a second for that. Okay. All right, Carrie, for those two items, 306 and 307.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Okay.
All right, so that moves to lines 308 and 309, also both in the medical care payments to providers map account 0147. This adjusts funding in the medical care payments to providers program between the general fund and other special revenue funds related to the rebasing the hospital tax year from fiscal year 2015-16 to 2017-18. So I have a few notes here. I want to try and link some things together. So first, this increase in funding in the other special revenue account that decreases general fund goes along with the language part 00, which we'll be discussing a little bit later. And I also wanted to note the Hospital Association in their public testimony and then in a response to some questions have noted that there's a difference of just over $500,000 between the additional tax revenue that comes in here, which is a total of $11,818,376 to be precise. And comparing that to a couple lines later, we have lines 312 and 313, which provide increased funding to the supplemental payments to hospitals. And if you sum up the total of those two lines, which are a portion general fund and a portion of federal, there's $11,287,885. So what that is, that's an increase to the supplemental payments that actually go to the hospitals, and that's just over 11.2 million. But the increased tax coming in is just over 11.8 million, which leads to a $530,000 difference. I just wanted to point those out and try and link those lines because that came up a couple times, and I wanted to make sure you understood where it was on the document.
Thank you for that. Are there, at this point, I'll entertain a motion for 308.
No. Let's have a question.
Yes, Senator Moore.
I'm sorry. I think
No.
Senator Baldacci had his hand up, I think, as well. My question is that if we do not change the rebase and change the year, would that change the amount of monies that we would be getting, or as far as the tax that we're charging the hospitals? Or would it remain the same as it is currently? How would that work if we did not change the year?
If you do not change the years, the amount of tax coming in would remain the same that it was in this most recent year. So you wouldn't have this increase other special revenue of 11.8 million, but then also reduce the general fund. That's what the impact would be. You'd actually have, in the end, by not accepting this, that means that there's an $11.8 million general fund reduction that is no longer part of the budget.
If I may add, Senator, as well, I just want to be crystal clear that this does not change the hospital tax rate in any way, shape, or form. The tax rate remains the same as it's been in recent years. This is only updating the year of which that tax rate is applied to. And you can see it's what Luke just spelled out. We're going from 2016 to 2018, which the revenues of the hospitals increased by about $500 million.
Although that doesn't reflect, yeah, go ahead, Senator Baldacci.
Thank you, Mr. Chair. I just want a clarification. So Luke, so is it basically that we're actually taking about 500,000 out of the hospitals? I mean, is that the essence of these actions?
The two together, so that's lines 308 and 09, which are the rebasing, and 312 and 313, which are the increased payments to supplemental payments to the hospitals, would mean that the hospitals, by paying 11.8 million additional to the state and then only receiving back the 11.2, would be down an additional $530,000 from where they were, in the most recent year.
So I guess my question to the chair and the rest of the committee is that really our intent? So.
Okay. Representative Perry.
Thank you. Here is my conundrum with this. We have just had a year where the hospitals have had increased demand and also a decrease in business, where they are losing at least 20% of their income as a result of this. And yet we're rebasing to a year that was a much better year. What does this mean in terms of the survivability of some of these hospitals? We have one hospital that's just made it out of bankruptcy. We have another one that's hoping to work their way out. My concern is that we are hitting a tax that is taxing a business that's been hit hard because of the pandemic. And I just have some real concerns about what that means.
So, okay, so what's the impact? Are we required to rebase?
No, it's in statute right now that the hospital tax year is 2015-16, and it would just remain that way. There's nothing that says it has to be rebased. At
a future time, could we rebase into an average of a number of years?
Yes, something like that could be done. The rebasing has always been done this way, which is just to rebase to a specific year. But I'm sure there are other options if that's what you're thinking.
That's what I'm trying to sort out. Yes, Representative Zager.
Thank you, Senator. I guess two things now. One is that on that last point, I think that's an interesting idea of rebasing it to get more of an average or authentic picture of. But really, I raised my hand to echo what Representative Perry said, and also advance that it's having a hospital declare bankruptcy or having to shut down. That's of course a catastrophic development in a community or a whole catchment area. But I'm also concerned about more proximal losses, such as the loss of a service line. If a labor and delivery unit has to shut down within a hospital, or some other, or behavioral health floor, that's a real loss of service to the people of Maine, especially in the area around that hospital. So I just wanted to register that concern.
Representative Javner.
Thank you, Senator Claxton. Yes, of course, I echo Representative Perry and Representative Zager. The Lincoln Hospital is the one that I use, and they're the ones that just made it out of bankruptcy. I am wondering if we can actually hear from Jeff Austin, perhaps, or Lisa Harvey McPherson, so they can give a little bit more perspective on this. As of now, I'm not going to be willing to vote this rebasing in. So I don't know. Actually, does everyone else? How do you feel, Senator Claxton, or everyone else feel about hearing from Jeff Austin or Lisa?
Well, since he was nice enough to raise his hand, I think we really ought to hear from him. So yes, for being compliant alone, he gets to be heard. So thank you, Mr. Austin. Welcome.
Thank you, Senator Claxton, members of the committee. I appreciate you giving me an opportunity to speak. If you look at both my original testimony on this or the document that I sent to Anna today, but it was only within the hour. I'm not sure if she was able to get it sent out to you. You'll see a table on the second page. We accept that the hospital tax gets rebased. We accept that the state is going to make $8 million from this rebasing. We accept that we will get nothing from this rebasing, net. Our only request to you is that while the state is walking away with $8 million from us, that we not lose money as compared to where we are today. As proposed, we lose money compared to where we are today, $500,000. As you can see from my table, it only takes about $149,000 to fix that because there's federal match. So the question before you is, does the state get 8.6 million from me and I lose $500,000? Or does the state get 8.4 million from me and our members lose nothing? We'll walk away break even, and the state can walk away with 8.4 million more from hospitals. We just don't think it's fair for us to take a loss on this program. We're already taking a $23 million loss in this program, where most states don't do it that way. We should be break even. So that's our request. Sorry to be so pointed, but there's a lot of confusing numbers in here. And I think it's easiest to start at the bottom line. Bottom line is the state will make money off of this policy change. We will get nothing at best. As proposed, we lose $500,000 a year on top of the 23 we're already losing. Our request is that you amend both lines by 150,000 down on the tax line, or keep the tax line as it is, but amend up the supplemental payment line by 150,000 or whatever Luke's math appropriately says it would be, to make sure it's a break even. That would be our request. Thank you.
Mr. Chairman, I would make a motion to move in lines 308, 310, and 312, or the associated lines, with the adjustments to make sure that they are break even for the hospitals, as suggested by Mr. Austin in his written testimony.
I'll second.
I hear a second for that. Are there any questions or any further discussion? I will ask Luke, does he have the math right as to your understanding?
So I haven't actually done the math of what the 500,000 would be split up state federal, but it's close to that for sure.
Okay. The intent of my motion is that the $11.8 million rebasing still occur, but that the supplemental payments increase by an amount that would make sure that they are even and that there's no net loss to the hospitals.
Agreed.
Any further comments or questions? Senator Moore?
I was just saying, we probably need to make sure we address all of the lines in reference. I know he jumped from 308 to 320. We've got to remember the grade ones have to be included too.
Okay.
As
So
part of the motion.
308 through 314, that'd be correct?
That's it. There you go.
Through 313.
Yeah, 313.
313, okay.
Yeah. Thank you for that, Senator. Any other questions or is your hand back up again, Senator Moore? Okay. Any other comments? So we have a motion on the floor or in the committee to move in 308 through 313 with the revenue adjustment that was raised by Mr. Austin. Are we ready to vote? Okay, Carrie.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry. You're muted, Representative.
We can see you, but we can't hear you.
Yes.
There.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Thank you for that, Senator Moore.
So with that, we're now on to lines 314 through 318. These are in the state-funded foster care adoption assistance program, account 0139, the MAP account 0147, the Office of Substance Abuse and Mental Health Services, account Z202, and the Mental Health Services Community Medicaid account Z201. This provides funding for a new intensive outpatient program for high acuity main care members to address the gap in the state's behavioral health service system.
Any questions, comments? Entertain a motion to move in line 314 through 318.
So moved.
Second.
And a second. Okay, thank you. Let me take a look at line 319. Okay, so we'll go through 318. Carrie, can you move that along? Yep.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
So now we're on to lines 319 through 322. This is in the medical care payments to provider account 0147, the low cost drugs to main elderly program account 0202, mental health services community Medicaid account Z201, and the Office of Substance Abuse and Mental Health Services Medicaid seat account Z202. This provides funding to the medical care payments to provider program and decreases funding in the low cost drugs to main elderly program, the mental health services community Medicaid program, and the Office of Substance Abuse and Mental Health Services Medicaid seed program to consolidate the 4 Medicaid assistance programs into one program as part of the consolidation of main care related programs from 13 to 4.
Yes, Representative Javner.
Thank you very much, Senator Claxton. If I could just ask one question for Deputy Commissioner Mann, why this $3 million savings in the consolidation, why the $3 million savings cannot happen without the consolidation?
Good question. I guess in the absence of the consolidation, we would just be cutting the main care baseline budget by $3 million annually, which I would not suggest doing. The $3 million is a derivative of the consolidation effort itself. We've talked about having fewer accounts, being able to manage them better. I haven't the analogy I would use, if you have, household payments, including your rent bill and electricity and everything, and you were paying that on a weekly basis in different categories, you'd have to keep sufficient funding in each of those accounts to pay for your rent, to pay for your electricity, to pay for your water. And if you went over in any of those small, different categorized spending areas, you would lose your electricity or your water or something. I think if you consolidated everything into one larger account, it'd be easier to manage, and you would actually you'd be able to reduce the amount that you would need as cushion for those expenses. So the same thing is happening here in Maine Care. We actually we need less cushion in each of the 13 accounts if we are allowed to consolidate them into 4 larger accounts.
Does that answer your question,
Thank you.
Representative Jenner?
It does answer my question. I'm still, and I'm not understanding really why the cushion, can't be let down, in those accounts without the consolidation. Again, just the accountability. The accountability is the concern that I have with these line items, being consolidated. So I won't be voting to put these lines through. Thank you.
Is it fair to say, Deputy Commissioner Mann, that this really dampens the swings in the dollars that you need available at any given time?
It is fair to say that. I think there are some relatively small appropriated accounts, and we need to keep funding in those accounts. And some cycle payments are monthly, some are weekly, so there's some volatility between the cycle payments on a week by week basis. So by consolidating them into larger accounts of similar types, which we are proposing to do, we're proposing to keep all the waiver programs together, for example. We would that some of that volatility would be minimized through this approach. And I would also just reiterate that it's the same on our federal side. We would align our general fund appropriations to the federal accounts, which would be 4. So it would be similar, a mirroring effect going on, and that would also, be consistent and standardized on that front.
Thank you. Representative Connor, you had your hand up a minute ago.
Yes, thank you, Mr. Chair. I was just, as I was listening to Deputy Commissioner Mann, it struck me, it sounded like it's just one big fund to legalize robbing Peter to pay Paul and move money around to different accounts without any type of oversight to me. So like I said, I'm not a fan of the consolidation. I think if you have the funds and you have the budget with each amount of funds going to different accounts, there shouldn't be a discrepancy of $3 million, in my opinion, just to move around. So that was my only statement, Mr. Chair. Thank you.
Okay. Senator Moore.
Thank you, Senator Cox. I just really have a comment to make as well. It does concern me that we would go from the 13 to 4. When I worked in the corporate world, when we created line accounts for tracking purposes, it was for historical reasons. We wanted to be able to go back and compare apples to apples. I'm very concerned if we go from 13 down to 4 and we're lumping together the various sections, we're not going to have this historical information as to really where were we in 2021 or something to that effect. So I will not be in support of the consolidation.
Representative Perry?
That's a yes. Yes, I guess my question was, with that kind of savings, was there actually going to be administrative changes in terms of personnel that would help with that change as well, if you're looking at administrative look at different programs? But I don't hear that.
Administrative, we are not proposing any changes on the administrative side, no.
Representative Craven?
Thank you, Mr. Chair. So it sounds to me like there's really no savings, but you can just spend more.
was there a question there, Representative Craven?
Yeah, I wanted to know if that was so.
It's spent less, but so the main care account from 20 state fiscal year 19 to state fiscal year 20, there was a $32 million carry over from year to year. That $32 million is split out between 13 general fund accounts. And not all of those accounts have the same, we have to manage each account individually. There's enrollment gains and different activities in each of those accounts that members come on and roll off at different rates. There's rate changes that are enacted, whether those are cost of living adjustments for certain services. There are other utilization changes that happen every year, and those utilization changes have swung even more so along with the enrollment gains during COVID. There's more volatility in the account. The administrative burden to manage main care, to make sure that there are no cycle crashes and that providers get their payments so that they can cover the costs of members that are on main care, is made harder by having the historical anomaly, in my view, of having the 13 accounts. I've said before, our intention is not to reduce transparency in any way, shape, or form. We have monthly reports that we provide to OFPR where we've started the conversations around how to report on that going forward. Appropriations are only one form of the insight into the accounts, and in many ways, appropriations are not the best way to understand what is going on in the main care account. I think the services underneath those at a much lower granular level is the better way of understanding exactly which members are getting which services and providers are providing those services. So this is, again, we are, it sounds like it's falling short, but it is the truth, or that by consolidating accounts, there's less volatility across those accounts, and we would be able to manage more closely to what the budgeted amounts are needed would be to manage that volatility, both from on a week-by-week basis and between fiscal years.
Are there other questions? I would entertain a motion on lines 319 through 322. Yes, Representative Craven.
Thank you, Mr. Chair. I moved in.
You voted the motion was to move in.
I will second that motion, but I think it would be, I think that the central issue for a lot of committee members is the fact that I don't think the $3 million savings has been completely explained how we're achieving that, but it does make, in the normal course of things, it does make bureaucratic efficiency to consolidate certain things. I mean, you could also say that there's money being wasted by having 13 separate accounts, but I will second the motion.
Yes, Representative Lemelin.
Thank you, Senator. I think certain people are focusing on the $3 million savings, and that's not the huge concern. The concern is accountability. In the future, they are going to be able to do whatever they want with the money. If they want to move this much money to this account, they'll be able to do it freely without our oversight. That's dangerous. Going from 13 to 4, this is very, very imprudent on the business side. Now, of course, if I were Mr. Mann, I would try to sneak this in too, because it would make my life a lot easier, and now my office can do what they want without accountability or oversight. So my hat's off to him, but business-wise, this is a very poor idea.
Senator Moore.
Thank you, Senator Claxton. I'm just trying to verify if this motion is covering from 319 through 324, or is it stopping at 322?
I stopped at 322, but that's what we got the motion for.
I'm just wondering if we would consider adding the additional 2 lines because they're dealing with the same thing, the 13 to 4.
Great. Yeah, let's just leave it the way it is because one's a nursing facility and the other is other providers. So let's just go through 322. Any other comments or concerns or questions? Just as a point of clarification, go ahead.
Just
Mr.
going
Mann?
to clarify in response to the prior comment that I can assure the committee that we do not move money freely between accounts. The legislature appropriates money to certain accounts. We are proposing to consolidate several of those accounts together, but the legislature would still appropriate whatever it deems necessary and appropriate to those accounts. And then we run those programs and pay out through the claims system, which is the vast majority of how the money gets pushed out to providers, hospitals that you just heard from, nursing facilities, all main care providers across the state through rules and state statute that we follow in coordination with federal statute and federal regulations. So healthcare is a highly regulated industry, as I know you all know, but this is a small effort to improve some of the administrative ease by which those rules and compliance requirements will be followed. So I just wanted to make sure that this committee was aware of the importance that we place on compliance with all of the federal and state requirements over the main Medicaid program that we run here at DHHS.
So thank you for that clarification. And just for my memory, I have the recollection that we heard from Luke Lazur that there's a difference between accounting tracking and performance compliance tracking with delivery of services. Is that a fair statement, Luke? And at the extension of that being, that would allow you to track the programs, if not the dollars in the way we do currently.
I think the explanation I gave was that in most of these programs, the difference between having the money appropriated to these separate accounts and having them appropriated to one account did not have a huge impact because I and the accounting system can still track the funds by the programs that are being discussed. There was one where there was a minor issue where 2 of the waiver programs use the same code in the accounting system. So I wouldn't be able to differentiate between those 2 programs. But I think across all these other program changes, I was still able to identify the specific programs in the accounting system. The other piece you're talking about, the compliance, is that when it comes to federal reporting, how the money is appropriated is not the final be all end all of how the federal reporting is done. The federal reporting is also done based on information in the accounting system because the data is broken down quite differently than the way that the appropriations are broken down. So I think those 3 pieces are there. And on the document that I created that talked about the program consolidation, one of the things I tried to identify was my ability in helping the legislature to still understand what the expenditures were within each of these programs. And as I said, there was really only the one where there was an issue just because the 2 programs go to one code in the system.
And Luke, was that something you sent just recently that you referenced that?
That document is something that we discussed when we went through these all the first time, and it is up on the HHS committee webpage under the biennial budget.
So it's not the one that you just sent. Okay. Yes, Representative Connor.
Thank you, Mr. Chair. Luke and Deputy Commissioner Mann, if you could just explain something to me very quickly. If we do this and we consolidate, and a lump sum of money is given to one account that now has, let's just say, 3 accounts under it that were separate line items before. If the department starts running low on with expenditures on one of those accounts, will they now have the ability to freely move money from one of the other accounts that are consolidated under that one account to the account that is now being, running a little low? Will that be the case? Will they be able to do that without any, oversight from this committee? Or will they have to come back to the committee to move money within accounts that have been under the consolidation?
So let's start with the way it is now. Okay. So the legislature appropriates money to these separate accounts. As the year goes along, as payments are made, some of these accounts, when payments are made are at very odd times, and the accounts will at one point in time be low and at one point in time be high. And money already right now under the current system with a financial order, money is moved between different programs to handle that sort of churn within the cycle. That's done as we speak. I think the difference under this other scenario is that when you're appropriating, you're not appropriating at these 13 different accounts. There's not these 13 separate appropriations. There's now just going to be 4 appropriations. I think the idea is that there'll be less movement of money. The money will be put in an appropriation, and more likely that's where the money will stay. They'll have to do less financial orders to move money around, because now there's a bigger pot of money to handle that up and down that happens within the cycle. So I think that's the idea behind this consolidation.
Okay.
Thank you. That's all I have, Mr. Chair. Thank you.
It's a good question. And just to reiterate what Luke said, it's primarily for cash flow purposes and timing.
Okay. So there's a motion on the floor to approve 319 through 322. And a second. So that's our cue to turn it to Carrie if there's no other questions. Carrie?
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
No.
Representative Lemlin, no. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Mhm.
Representative Perry is absent. Representative Griffin,
No.
Representative Griffin, no. Representative Connor,
No.
Representative Connor, no. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
No.
Representative Javner, no. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 7 yes, 5 no.
Thank you. All right, Luke, now to 323.
Yes, so the next lines are 323 and 324. And this is in the nursing facility account 0148 and the PNMI room and board account Z009. This increases funding in the nursing facilities program and decreases funding in the private non-medical institutions room and board program to consolidate the 2 residential programs into 1 program as part of the consolidation of main care related programs from 13 to 4.
I would move to include 323 and 324.
I will second that.
Okay, so there's a motion and second. Any comments, any questions? Okay, Carrie, I guess it's time to vote again.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
No.
Representative Lemlin, no. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry, Representative Perry is absent. Representative Griffin,
No.
Representative Griffin, no. Representative Connor,
No.
Representative Connor, no. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
No.
Representative Javner, no. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 7 yes, 5 no.
And 1 absent. Okay. So 325 and 326.
Yes, so lines 325 and 326 are both in the medical care payments to providers map account 0147. This provides funding to modify main care estate recovery rules to the mandatory federal requirements.
Yes, Senator Moore.
Yes, I would make a motion that we move lines 325 and 326 into the budget.
Second.
There's been a motion and second. Thank you both. Any questions or concerns about those two lines? Then it's time to vote again, Carrie.
I'm sorry, Senator Claxton, I see a couple hands up.
Oh,
Do we need
yes,
to?
Ms. Dooling, thank you. I didn't see that.
I'm sorry, I can defer to Luke if you wanted, but there is associated language that would need to be added, I think, to this initiative. That's consistent with Representative Perry's bill 1954 from last session.
So we can add that to the discussions tomorrow. That language will be ready by then.
I can send it out when Anna sends out the language for 1377 as well.
Okay, great, great. Any other comments? Thank you for that. I didn't see Luke's hand because his hand was in front of the emblem again. And I will note that Representative Connor has changed light color in the background. Thank you, sir. So that it was much easier to see the hand up. Okay. So there's a motion on the floor to approve 325 and 326. So now we can vote. Carrie.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry, Representative Perry is absent. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Great, so now we're on to lines 327 through 330. These are in the nursing facility account 0148, the residential treatment facilities assessment account Z197, the Medicaid Services Developmental Services account Z210, and the Developmental Disability Service Waiver Supports account Z212. This increases funding in the nursing facility program and decreases funding in the residential treatment facilities assessment program, the Medicaid Services Developmental Services program, and the Developmental Services Waiver Supports program to consolidate the four programs into one as part of the consolidation of main care related programs and accounts. I will just note that these are a little different than the ones we've discussed so far. These are all just other special revenue accounts. These are consolidating the different taxes. There's a service provider tax, there's a nursing facility tax, and there is also a residential treatment facility tax there. And this is consolidating the actual tax revenue that comes in from multiple accounts into just the one nursing facility account.
Mr. Chairman, I would move to include this into the budget.
Lines 327 through 330. I moved and seconded, I heard. Any inclination to go any further with this type of item? So why don't we also then go 331 through 334?
Okay.
And 335 through 336. And 337 through 338, and stop there.
So moved.
Thank you, sir. Is the second still comfortable with that expansion of the vote?
Yes.
There we go. Thank you. So there's been a motion, it's been seconded. Is there any discussion about those lines? Then it becomes Carrie's turn again. Thank you.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
No.
Representative Lemlin, no. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Either he's meditating or he's frozen. Representative Baldacci, we're not seeing you moving. Why don't we skip Representative Baldacci?
Representative Perry. Representative Perry is absent. Representative Griffin,
No.
Representative Griffin, no. Representative Connor,
No.
Representative Connor, no. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
No.
Representative Javner, no. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. Is Senator Baldacci?
Doesn't look like it.
Okay. So that's 6 yes, 5 no, 2 absent.
Okay. So that gets us to 339.
Yes, so account lines 339 and 340 are both in the MAP account 0147. This reduces outpatient reimbursement to 100% of costs for facilities meeting the federal regulatory definition of institutes for mental disease.
Yes, Representative Senator Baldacci.
Can you hear me? Okay, it's the video is a little slow, but I would move that this item be amended to, I don't know if we want to amend it or not, but I want to leave the 117% the way it is. So so my motion is to not reduce the outpatient reimbursement, to leave it at the 117% of costs, which has been the practice in order to incentivize a number of these hospitals to provide important psychiatric care inpatient. This would adversely affect Northern Light Acadia Hospital, and as well as Spring Harbor. It's really unnecessary to the overall budget.
So is that a motion? The motion is to not move into the budget.
Right.
Is there a second for that?
That is it. Thank you, Mr.
I
Chairman.
second that not to pass.
I'll second.
There's a motion and a second not to move that into the budget. Is there any discussion? I see, yes, Representative Javner.
I apologize, Senator Claxton, but do we want to perhaps move the 341 and 342, including in that, to not move those ones in as well, or?
Yeah, that I would be a friendly amendment.
Okay, so the amendment stands expanded. The second is okay with that, apparently. Any other questions of the committee? There being none, I think we turn to Carrie for the vote.
Oh, I'm sorry. I just want to be clarified. When we say moving 341, 332, 342, we're not including the exceptions. Is that correct, Representative Javner? I just want to make sure we're all on the same.
So the motion that I heard, correct me if I'm wrong, is
Okay.
that those items not be moved into the budget.
Okay. Thank you. I appreciate it.
Okay. Very good. Now it's your turn, Carrie.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
Okay.
This moves us on to lines 343 and 344, which are both in the MAP account 0147. This reduces funding in the medical care payments to providers program due to a one-time anticipated reduction pursuant to the department's rule chapter 101, Main Care Benefits Manual, chapter 2, section 113, non-emergency transportation services broker payments for fiscal year 21 and 20, for state fiscal year 21-22. So as it notes, this is just a one-time in state fiscal year 22.
Okay. Any appetite for going further? Yes, Representative Lemlin.
Yes, I think we can go down to 346.
So 343 through 346.
Yes, sir.
Want to take that as a motion? And a second out there?
Second.
Motion's been made and seconded. Are there any concerns or questions that members of the committee want to raise? I don't see any, so that we move to Carrie to vote on.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
She said she just lost power. She'll be right back.
Okay, thank you. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 12 yes, 1 absent.
And that moves us along to lines 347 through 349. These are all in the MAP account 0147. This reduces funding for savings achieved by establishing a reimbursement methodology that reimburses providers under the federal 340B program at the approximate cost of physician-administered drugs under that program.
Yes, Senator Baldacci?
So essentially, there's not going to be any reduction in service. Is that correct? And they're going to utilize the monies from this rebate. Is that where the savings are coming from? Can I ask Mr. Mann to answer that? Or
Certainly. The 340B program isn't, it's an acquisition for drugs program. So for there will be a reduction in the reimbursement that the state is providing to 340B providers. Right now, those 340B providers purchase drugs at discounted rates, yet the state reimburses them at a rate that that does not reflect those savings. We are have been instructed by CMS to close that gap, and Maine is one of the final states to proceed along those lines.
Senator Moore?
This is another one of those programs that I get real apprehensive right now when we have, as mentioned earlier, one hospital that's just coming out of Chapter 11 and one that is hoping to come out of Chapter 11. They have been really counting on this 340B program. It was designed, the discount program was designed to help lower costs for the hospitals. This is not the time. I understand CMS is telling us that we have to, but this is not the time for us to be at that point where we're going to be taking anything away from our hospitals. I guess, Senator Claxton, I would ask if perhaps we could ask Jeff Austin to maybe comment down on that as well. That would be okay with the committee.
That would be fine by me. Mr. Austin?
Thank you, Senators. I appreciate the opportunity to comment. First thing, as you all know, please remember the $2 million you save carries with it around $5 million in match that we lose. You don't gain the benefit of that $5 million, Congress does. So the loss to us is bigger than $2 million per year. It's around $7 million per year. The question was, what's the impact of that? It's spread out across multiple hospitals, so it's hard to say in each and every case what the service impact would be. Our request all along has been, if the methodology has to change, and we're not party to the conversations between DHHS and CMS, but if it has to change and it produces savings for the state, the policy question for you, not really DHHS or CMS, but for you is, what do you do with that $2 million in savings? If it has to go forward, our request is that you leave it in the hospital outpatient reimbursement system. The hospitals get reimbursed a whole bunch of different ways. The hospital outpatient reimbursement system is very easy to explain. Medicaid takes the Medicare reimbursement rate and slashes it by 17%. That's what we get paid on the outpatient side. If those savings materialize, you can simply, just like on the tax and match, in a revenue neutral way, plow it back into our reimbursement rate. I think it would go from a 17% reduction to something like a 10 to 12% reduction compared to the Medicare rate. So again, I'm not party to the conversations. I trust the department is relaying what their conversations with CMS have been like. I want to thank the department. My understanding is that they've been pushing back on CMS and may have found a methodology from an administrative standpoint that is better for us, and we appreciate that. But the net result in dollar terms, I think, is still a $7 million per year loss to hospitals. So we would ask that whatever savings materialize, if it's still in that $2 million neighborhood, that get revenue neutral rolled back into hospital outpatient reimbursement rate so that we're not harmed by this methodology change that apparently the federal government is demanding. Thank you for the opportunity to comment.
Representative Craven.
Thank you, Mr. Chair. I'd like to know if there's a fine associated with not complying with CMS.
I'm not aware of a financial penalty that CMS will levy. I think what would similar, there are several like UPL, the upper payment limit issues that we've talked about, and we're going to talk about shortly here that do have financial implications. I think what CMS may and might say likely to do if we are continued to be non-compliant is they would cease actually matching the rate, which Jeff accurately indicated was 5 million on top of that 2 million. That would be the levers that they have, is to not allow the federal match on top of what the state contribution is. And I just want to draw a distinction as well. This is not an outpatient service. This is not a hospital outpatient service. This is a reimbursement methodology for 340B drugs. The analogy and the parallel between hospital outpatient services has been drawn several times in connection to this, and there are clear distinctions between both.
Mr. Chairman?
Yes, Senator Baldacci.
I would move that we go forward with the line 347 and 348, subject to that any savings be kept in hospital accounts so that the ultimate effect is revenue neutral. That would be my motion.
I second that.
There's a motion and a second. Can I ask a point of clarification from Mr. Mann? Is it possible to redirect those funds into the Medicaid compensation line?
I would presume so. We do have certain there's upper payment limit on hospitals, and we are below the current upper limit there. But if this committee's prerogative is to reinvest those savings, I can't give you the exact methodology by how we would do that, but we would. There's numerous ways to do that, presumably, but we could develop options and figure out how to do that. Yes.
Thank you. Representative Craven, did you have your hand still up or again? Okay. Any other questions related to the motion on the floor for 347 through 349 to move it into the budget with the understanding that the money is to go to the hospital reimbursement fund for main care? All right, so yes, Representative Deputy Director Mann, did you? No, okay. So now we'll go to, oh yes, Representative Zager.
Thank you, Mr. Chair. I just want to just get an understanding of, will that change how much we would draw down from the federal government? Maybe Mr. Mann or Mr.
No, it would there would be a change in the drawdown, but it would be split between different activities. So I think that wouldn't have a negative impact per se. I would have to check on the FMAP rates that 340B are subject to, that we are drawing down federal. Again, we're going to have to run a process on this to determine how that reinvestment would work if that moves forward. So, and then we would have to confirm the applicable federal match on whatever services would be being increased commensurate in the same line as the reduction on the 340B side.
Senator Moore.
I mean, I'm all for remaining neutral. I think that is so important, revenue neutral. What I'm a little concerned about right now is making sure we have our hands around how much we're talking about. Can it be done? Is the procedure in place? I hate for us to take a vote right now and have it get stuck in the budget incorrectly in the way we had it. So perhaps we should table it and then have it come back with that information for us to make a good, smart decision.
There's a motion to table. Is there a second?
Second, that's perfectly fine.
Okay, so there's a motion to table this discussion until a later date, being tomorrow morning. So Carrie, can you run the roll on the motion to table?
Yes. Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
So what we'd like for tomorrow is a better sense of what the opportunity is and what the mechanism is.
I would just note for this committee's awareness as well, the 340B providers are not only hospitals, they're FQHCs, they are all family planning. There's other 340B participants. So it would be need to be a creative solution on how to align the reduction on 340B with a reinvestment on the other side, because not all of that reimbursement would accrue to hospitals, since hospitals are not only the only 340B providers, if that makes sense.
That does make sense, and that's why the motion was made to get more information. So thank you, Senator Moore. Yeah, so if you can, I understand the limitations of hours to get that information, but if you can get us closer than where we are right now, that'd be helpful. Okay. So that gets us to 350.
So lines 350, 351. These are both in the map account 0147. This adjusts funding as a result of maximizing the federal medical assistance percentage by incorporating primary care case management, primary care health homes, and primary care provider incentive payments into population-based payments that are directly tied to performance on quality, utilization, and cost measures.
Yes, Representative Javner.
Thank you, Senator Claxton. I would make a motion to move lines 350 and 351 into the budget.
Second.
Any appetite for extending further? I assumed you might have mentioned that if there was. All right. So Carrie, it's your turn to collect the vote again, please.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Okay. Thank you.
So next, we're on to lines 352 through 354. These are all in the MAP account 0147, and it reduces funding to align the rate structures and fee schedule for purchased durable medical equipment with those used by the Federal Department of Health and Human Services Center for Medicare and Medicaid Services.
Any questions about DME dollars? And as I recollect the yes, Representative Perry.
Actually, that was what I was going to ask. Is this a reduction in reimbursement for DME providers, or is there a change other than that that shows this saving?
This is a necessary reduction to the reimbursement to providers because we're currently reimbursing over what the federal government allows, and we're not only doing that, but we owe money back to the federal government because they've issued a disallowance on the funds that we have paid over that UPL.
And as I recollect the conversation, this was is $200,000 over 27 million spend for DME.
That's correct.
I'll move those numbers in.
352 through 354.
Second.
Representative Javner.
I apologize. Yes, before we move forward then on a vote, I just need some clarification again from Deputy Commissioner Mann. So this is simply aligning, this is something that is coming from the federal government, then that we are needing to align with their regulations and their policy that is being set.
Just to provide a little bit more context, the upper payment limit is generally in alignment with what Medicare would reimburse for the same services. There are upper payment limit UPLs on hospital services, both inpatient and outpatient, nursing facilities, and durable medical equipment. There are others as well. So that is, one of the tenets of the Social Security Act under which Medicaid is created is reimbursing on an economical basis. And that is sort of the base litmus test of what Medicare would reimburse for. We have for, I believe 3 years reimbursed over that UPL for DME providers. So we are proposing, there are several ways to reduce that payment. We've discussed previously some splits between rural and urban reimbursement. There's differences that can be made between how equipment is purchased versus rented. So we'll try to incentivize some of those that make sense in alignment with what the feds allow. And we are proposing that $200,000 or just over $500,000 reduction in DME overall, which I think as Mr. Chairman indicated last time, I believe that was right around 2% of the total reimbursement on an annual basis.
And I apologize, Chair, if I may.
Sure.
Deputy Commissioner Mann, can you just reiterate again the amount that we are paying? You said we have to make a payment back to the federal government? Was that what I heard?
When you exceed the UPL, CMS generally issues deferral letters, which means that we owe money back to them. It's essentially an audit and of that financial penalty that we asked for. That that proposal was included in the supplemental budget. It's not included in the biennial budget. The supplemental request, which I don't want to misspeak, I'm going to ask Jeff to look that up. It was under $1 million, I know, was for fiscal years 19, 20, and 21, which were the ones that we exceeded the upper payment limit. And this has been a long-standing issue of needing to change the rate of reimbursement so that we wouldn't exceed the UPL, and we are taking that action now. A, because we need to generate savings for the biennial budget, and B, because it's a compliance issue for us.
Thank you very much.
And did you do some work with the DME providers to settle on that methodology? Are they even part of the conversation at all?
They will be. We'll need to do rulemaking, and there'll be a comment and feedback session related to all of that on how to with what makes sense in terms of policy decisions on how to get under the UPL.
Okay. All right. So there's a motion on the floor. I wasn't aware of a second. Second. Okay. So it's moved and seconded to move in 352 through 354. So as long as that, we'll quit there and then vote on it. So Carrie.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So before we proceed, I'd entertain a motion to take a 10-minute break. We've been sitting for an hour and 3/4. So that's not good for you.
So moved.
And a second. All those in favor? We'll see you at 2:51. We'll start again as soon as we get a couple more people back. The sun's come around further, hasn't it, Representative Lemlin? Now it's coming in that window.
Yeah, it's setting behind me.
Nice. Okay,
Sure.
so Luke, 355.
Senator?
Yes, I'm sorry, Representative Lemlin.
Yeah, I make a motion to dispense with the reading and move 355 through 363 and
I second that motion.
Thank you for that. So there's been a motion and a second before we go to a vote. Any discussion, questions, concerns? There being none, we'll go ahead and ask Carrie to run the tally.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
She's muted.
Yes. Yes.
Representative Craven, yes. Representative Madigan. I'm sorry, Representative Madigan, I couldn't hear you.
Now, can you turn up the volume on that thing?
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
That gets us to lines 364 through 366. Send the medical care payments to provider account 0147, low-cost drugs to main elderly account 0202. And this eliminates the pharmacy incentive payment to pharmacies serving main care members residing in rural areas.
Yes, Senator Moore.
Yes, thank you, Senator Claxton. I'm a little concerned about actually eliminating this incentive. Living in rural Washington County, we have, very few local family pharmacies and so forth. And if we discontinue the dispensing of it, I'm going to have my little towns like Eastport and Perry and Pembroke that are not going to have the availability of a pharmacy that is willing to actually deliver to them when they're not able to get into the Walgreens or the Walmarts that are in the larger towns. So I am not going to vote in support of this elimination.
Can I follow up with that, Senator Moore? Have you had a conversation with the pharmacists and margins such that they wouldn't be able to reliably continue a certain service?
I have not, Senator Claxton, to be honest with you.
Yeah, and I just wondered because I haven't talked to any of mine either, and I'll ask the question from the department then. Were the smaller private pharmacies included in the conversation from the rural area?
I have not been aware of proactive outreach to them on this initiative. It wouldn't have been me making that outreach though, so I would just caveat it with that.
Okay.
I know you all know this as well, but the creation of the rural incentive payment was done at a time when the dispensing fee was $3.35. It was the $3.30, which is listed here, is inaccurate. It was $3.35, but it is now nearly 3 times that amount, and that was changed in 2018, relatively recently. So the impact of that, or the necessity of that rural incentive dispensing fee, has been, in my estimation, subsumed by the higher dispensing fee overall in practice right now.
And just for my information, as I remember it, these $351,000 are matched by some federal dollars, about 700,000.
Yes, sir. You can see it looks like close to about $1 million. Lines 365 and 366.
Yeah.
Mr. Chairman?
Yes. Senator Baldacci.
Thank you. I would move not to include lines 364 and 365 in the budget. I would be willing to also not include 366 and 367, but I don't know if people want to go that far or not, but I'm definitely moving to not include 364 and 365.
And 66, which is associated with it. Let's any enthusiasm for going further?
Well, we could.
Okay, so we'll
Got a
extend
hand raised.
67, 68, and 69 we'll add.
Okay.
And
I'd second
then
that motion.
70 and 71 are adjustments. Include those?
I would second the original motion, Mr. Chair.
Okay, so we'll go through 364 through 366, call it good there, and vote on that. There's been a motion. A second?
Second.
Representative Connor, thank you.
Just a reminder, the motion is to not move them into the budget, correct?
Correct.
Okay, thank you for the
Thank you for
clarification.
that. Right. Okay. So are there be any other conversations or questions? We'll defer to Carrie to run the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
Okay. Now we'll get to 367.
This moves us on to lines 370 and 371. These are both in the map account.
We didn't
Yeah.
vote on 367, Luke.
Yeah, we confused you, Luke. We initially started to go there. I didn't because I had the motion backwards from where I thought we were going to go. So we
Okay.
quit at 366, and
Okay.
now we're talking about 367.
All right then. So
Sorry
then
about that.
367 through 369 are in the MAP account 0147, the low-cost drugs to Maine elderly program 0202, and it reduces the main care prescription drug dispensing fee.
Okay, and we had some language correction in the 3/6 column where instead of what it says, it should say this initiative will align the main care pharmacy dispensing fee with the New England average of 1059 instead of the main average of 1189. Is that correct?
Yeah, instead of the current fee of 1189, yes.
Yes. Okay. Thank you. I saw Representative Connor's hand up. No. Senator Moore?
I just have a question as to who this will affect. This pharmacy dispensing fee, is that like our CVS's and our Walgreens and our Walmarts?
It's retail pharmacies, so any pharmacies that are participants in the main care pharmacy program, yes, I presume Walgreens and CVS within the state are such providers. But I don't know that to be sure, but it's logical that they would be.
So I'll entertain a motion on this. Yes, I'm sorry, Representative Craven.
Thank you, Mr. Chair. I guess I want to know why the pharmacies need to have a dispensing fee for a prescription that they're getting paid for already. I just don't understand how that works.
I'm not overly familiar with it either, but I do know that the training and the actual, that is how the business model is set up at retail pharmacies as a dispensing fee, which is not specific to Medicaid by any means, but there's that dispensing fee goes into the whole business model for the overall pharmacy.
Yeah, the pharmacies have to maintain a inventory, they have to restock, and they have to count the pills, whether it's 30 or 90. They got to put labels on the little bottles they gotta to put up, or the big bottles. And somebody responsible has to double check it usually. So it's a labor intensive, somewhat inventory intensive process. Senator Moore.
I guess my question would be is why do we feel the need that we need to move to the national average as opposed to keeping it at the New England average?
Yeah.
Sorry, Senator Claxton clarified that the description should have been updated with it's the 1059 is the dispensing cost, average cost in New England, and 1189 is what Maine is currently paying. I would just answer that overall, the department looked across all of the departmental programs, including all of Maine Care. And a lot of these initiatives that have been being considered are, sometimes smallish, sometimes in the hundreds of thousands, sometimes larger than that. But overall, we needed to hit there are trade-offs to be made in the budget, particularly this year with state revenues $600 million lower than what was projected originally over fiscal 21, 22, and 23. So all of the initiatives, despite the individual size of each one, add up to the overall proposal of the governor's budget. And we tried to prioritize the ones that had the least impact and or had compliance or other parity and equity issues related to them. This one in particular, it would be a cut in the reimbursement for retail pharmacies. We did think there was an opportunity here, given that the New England the New England average cost is lower than Maine's, and look to that opportunity to contribute to the overall savings portfolio that we were putting forward.
Now, does Maine, thank you, does Maine Care reimburse us for that dispensing fee?
That is the Maine Care reimbursing dispensing fee reimbursement there, $11.89. We're proposing to lower it to $10.59.
But Maine Care is, but I mean, Maine Care is reimbursing us the $11.89.
Maine Care is reimbursing pharmacies who actually provide the prescription to a customer.
Okay. Thank you.
Sure. Representative Jevner?
Thank you very much. Thank you, Chair Claxton. Yeah, I just cannot approve moving these lines in for our pharmacies on any level to have a cuts in, especially in the rural area for my constituents in this situation. It's pretty vital that these services stay as they have been, as they've been served. And so I will not be approving these into the budget. Although I do appreciate the fact that we're trying to save money, but in this aspect, I can't vote for that.
Okay, Senator Baldacci?
Thank you, Mr. Chairman. I'm going to move to table this, and I would like to get additional information from the department. One, I understand there was a typo there, but it was significant kind of in our understanding. But more importantly, I think that what Senator Moore was trying to get at was what the impact would be on federal revenues, because we get a match from the federal government. So I'd like to get more information about how this is going to impact us in terms of what we get from the federal government, how this is going to impact. I'd like more information about, you know, the payments to the pharmacists, because the people that I think we're all, a lot of us are concerned about, the small independent pharmacies.
So there's a motion to table. Is there a second?
Yes. Or a second?
Is there a second to the tabling motion?
Second.
I hear a second. Representative Perry, did you want to weigh in?
Yeah, just for a second, I'm looking at the how the federal dollars fit into this, and I think that's why we're tabling it, is how the mix of reimbursement goes in terms of tabling, and also how Maine got to where it's at in terms of reimbursement, and where the limitations are. I think we need a little history, because I remember when we put the rural thing in. It's terrible, I'm getting old. You know, we were losing a lot of independent pharmacies at the time. And
so there's a motion on the floor to table.
yeah, we're talking about a 10% cut, and I just.
Okay, so that means we need to vote. So is there, so Carrie, it's to you to run the list.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Okay, so that gets us to 370.
Should Mr. Chair,
Please.
I just want to, maybe before the end of the session today or right now, I just want to make sure I understand what the getbacks to the committee are on this initiative and the 340B initiative, just so there's going to be honestly limited, we can pull some information. It sounds like perhaps the number of pharmacies that receive the dispensing fee in Medicaid in main care might be of note. The federal revenues related to this initiative are on 369, line 369. So the full impact, the financial impact is laid out here on the green sheet. But I do want to make sure I understand what the committee's request is of the department.
So I think we're looking at the number of pharmacies impacted, and do we have a sense of what an average community pharmacy would lose with this? Do we have the capacity to average that?
I could ask.
Okay. If we had that information, would that meet the committee's needs? Would that help meet the committee's needs? Are there any others you want to flag? Any other data points? I don't hear any others. Okay. All righty. So now to 370.
All right, so lines 370, 371 are both to the map account 0147 and adjust funding between the general fund and other special revenue funds within the main care pharmacy program to reflect the drug rebates received annually.
Yes, Representative Javner.
Thank you, Chair Claxton. I would make a motion to move lines 370 to 384 into the budget.
Second.
Oh, there's been a motion and a second to run through line 384, starting at 370. Is there any discussion or questions or concerns about any of those lines?
Did you have a second? I'll second it.
Yep, we heard a second. Yep. Yes. Representative Connor got there first, Senator. I don't see anything, Carrie, so it's on you to run the line. Thank you.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven. Representative Craven.
You're unmuted now, Representative Craven. Can you say yes or no?
Yeah, I said yes.
Now
Thank
we
you.
hear it.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that completes our first run through of the green document. So we'll move over to the purple language document. And we're starting with part LL. That's line 486. This part updates the United States Department of Labor Bureau of Labor and Statistics Consumer Price Index to be used for cost of living adjustments from the Medical Care Services Index to the Nursing and Adult Daycare Services Index.
Yes, Senator Moore.
I would make the motion that we move the language OO into the budget. No,
I'll
oh,
second.
excuse me, LL. Sorry about that.
Right.
LL.
Okay,
I'll second it.
there's a motion and a second. As long as we're, okay. This is language, OO is language you've already considered, correct? Okay, let's go with LL. There's been a motion and a second. Let's run the votes. For you, Carrie.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan. I'm sorry, Representative Madigan, I can't.
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Okay,
So next is part OO, which is line 489 on the purple document. And this part updates the base year for the hospital tax. So this relates to lines 308 and 309, which were voted in earlier.
any questions about this line? Yes, Representative Craven.
Thank you. Does it have to be amended because that we changed the 489 line in the budget?
No, it does not, because the lines that were changed are a separate initiative. They're the actual payments out the door, and that change is only happening in Part A. This just changes the hospital tax year, which relates to these lines, which were not actually changed in that vote.
Okay, thanks.
Any other questions? Then before we vote, I'd entertain a motion
I move in,
and a second.
Second.
Thank you, Representative Levelin. So there's been a motion and a second. Your turn again, Carrie.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover, Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Next, we move to part SS on the purple document, which is line 493. This part contains transition provisions for the consolidation of general fund programs from 13 to 4 in the Department of Health and Human Services, Office of Main Care Services. Additionally, all existing contracts, agreements, and compacts currently in effect in the Department of Health and Human Services continue in effect. This language is really for the general fund lines, especially as it allows for everything that's currently in those general fund accounts that are of a different appropriation now, that they're still in effect when it moves to the other appropriation. And it also allows the department to move any funding that remains in those accounts at the end of this biennium into the new accounts.
Any questions? I don't see any. Therefore, I'll entertain a motion on line 493 SS.
I move in line SS language.
And a second.
I'll second it.
Thank you. So there's a motion and a second. Any discussion before we go to Carrie? I don't see any. So it's your turn again, Carrie.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. It appears Senator Baldacci is frozen. I'll come back to him if he's back with us.
Yep.
Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 5 no, 1 absent.
Okay.
That moves us on to the last language part, part ZZ. This is line 500 on the purple document. This part authorizes the Department of Health and Human Services to transfer available balances of appropriations between the main care general fund accounts for the 2022-2023 biennium.
Yes, Senator Moore.
I would make the motion that we move language line or part ZZ into the budget.
Second.
There's a motion and a second. Thank you. Any discussion before we vote? Time to vote again, Carrie.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci is connecting to audio. Senator Baldacci?
Yes.
Senator Baldacci, yes. Representative Perry?
Yes.
Representative Perry, yes. Representative Griffin?
Yes.
Representative Griffin, yes. Representative Connor?
Yes.
Representative Connor, yes. Representative Craven?
Yes.
Representative Craven, yes. Representative Madigan?
Yes.
Representative Madigan, yes. Representative Javner?
Yes.
Representative Javner, yes. Senator Moore?
Yes.
Senator Moore, yes. Representative Meyer?
Yes.
Representative Meyer, yes. Senator Claxton?
Yes.
Senator Claxton, yes.
So as I understand the work remaining, and correct me if we're wrong, there's a couple of outstanding lines, 250 and 251. There are 3 or 4 amendments and a couple of lines, BBB and EEE, that have been tabled. What am I missing?
The only thing missing from that are just that there are also were a couple of tables today as well.
Yes,
Lines
360.
347 through 349, and then also 367 through 369.
Yeah, and those are on the agenda for tomorrow. I don't think we'll get through the other things that we listed today. But I would like to get started on a list if people are okay with that. I see some head nodding. Okay, so let's go to line 250.
All right, so line 250 on the green document is in the Maine Center for Disease Control and Prevention, account 0143, and it provides funding to support development of a strategy and one-time investments in public health infrastructure to reduce disparities in income and outcomes for residents of the state and minority groups.
So are there any questions or concerns about this one that we want to bring up? Yes, Representative Perry.
Thank you. This is, at this point, one-time funding. I think this is something that we definitely need to have over the biennium and to reestablish this office. So I would like to move this in.
Motion made, a second has been offered. Representative Zager.
Thank you, Mr. Chair. I concur, and I will just add that my vote in support of this is in full acknowledgement that this is the beginning of, or the investment in a strategy, especially in a state that has the worst, at times, the worst COVID disparities in the country. Thank you, Mr. Chair.
Any other comments or concerns? There's a motion on the floor. It's been seconded. We can move to vote on it then, Carrie.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. I'm sorry, I still can't hear you, Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 8 yes, 5 no.
Okay. That gets us to 251.
The line 251 is in the Office of Substance Abuse Mental Health Services, account Z199. It provides one-time funding to establish the overdose prevention through intensive outreach naloxone and safety program to raise awareness about drug overdose and risks and to promote the new opiate use disorder and substance use disorder treatment locator.
Mr. Chairman, I would move to include line 251.
Thank you.
Second.
And a second. Any questions or concerns about this one? Okay, so it's up to you again, Ms. Withy.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
No.
Representative Javner, no. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 8 yes, 5 no.
The chair would like to point out that the chair was out of order on allowing the vote on these without having them come off the table first. So I just want to acknowledge that. I think the discussion reflects how we feel about the two items. I don't feel obliged to go back unless somebody wants to give me a bad time on Robert's rules, but that should have come off the table first. So I'm looking for anybody who wants to say we need to do that over again. I don't see anybody putting their hands up, so I continue to learn. Thank you. Before we get to some of the other considerations on some of the language, since one of the amendments directly impacts line BB, I'd like to discuss Senator Baldacci's proposed amendment. And I will defer to you to introduce it, and then Luke can walk us through it. I understand there's something ready for that.
Thank you, Mr. Chairman. I circulated to everybody on the committee my proposed amendment. I reviewed with staff, and Ms. Broom had prepared it. Basically, before 2013, the state had paid 90% of the cost of general assistance. And just so everybody knows, general assistance is a state mandate. It is the law that every municipality in the state has to provide a general assistance program, provides emergency needs to really the poorest of the poor for housing, emergency medical, other emergency type needs. And it's a cost that is, unfortunately, when the state is not fully reimbursing for their mandate, falls on the local property tax payer. So my amendment merely is to return the law at least to where it was before 2013 and have the state pick up the 90% share. We're in the middle of a pandemic where city budgets, local budgets have been strained to meet this emergency, this public health emergency, and have had to chip in, millions of dollars to pay for this. I think the state can afford to go back to the 90%. I think it will help local property taxpayers. To some extent, it will help municipal budgets. And it really is the right thing to do, considering this is a state mandated law for every municipality. So that I would ask, I think the fiscal note is 1.2 million, which I would propose deducting from the 3 million that's being returned to the general fund. Thank you, Mr. Chairman.
And you worked with Anna on that one, did you?
Yes.
Is there anything else we should know related to that amendment, Anna, that you want to speak to?
I just want to say that this is the same language that was in Representative Brennan's LD 1403 last year, and it was a bill that was left on the table at the upon adjournment. It doesn't go exactly back to before times. I don't mean before pandemic times. I mean before 90%, 70% times. Initially, or once upon a time, there was the 90% and 50%, and it was changed to 70% for all. And Representative Brennan and this committee, I don't remember the vote, to be honest with you, but those that voted for the amendment voted to reinstate the 90% for those communities that reach a certain threshold. and kept the 70% for everybody else so that they would be held harmless.
A certain
And I think Luke has the
threshold.
sorry, and Luke has the language and he can share it if you'd like.
Okay, but you mentioned a certain threshold. What was the
Right,
threshold?
and I knew you were going to ask me, and I wasn't prepared for it. Luke, can you bring it up so we can see
Yeah,
it?
yeah, I can just bring it up. I'll share my screen so everyone can see this.
So it's when a municipality meets the 0.003% of that municipality's most recent state valuation. That's right, Luke?
Yes.
Yeah.
Okay, thank you. Okay. Luke, is there anything else you want to do with this bill, fiscal note or anything?
I'll just show the actual appropriation that's in the bill, the 1.1 million, and just show you that the fiscal note is that full 1.18 million because it's all general fund.
Okay.
So I would ask, I'd move to approve this amendment. If it does get approved, Mr. Chairman, I think that we would be amending line BBB
Right.
in accordance.
Okay, let me talk to some members of the committee here. Representative Madigan, you had your hand up early. Yeah, we can't hear you at all. Have you got a microphone plugged into the side of your machine so that it's going through a microphone somewhere else, or? Okay. You may need to call in because we can't hear a thing.
It's fine.
Okay.
I'm good with the amendment. I live in a town that many outlying towns have people in crisis, that are homeless come into town. So I think for service center communities, this is really important.
All right. Yes, Representative Javner.
Thank you, Senator Claxton. I just would ask the indulgence and permission to caucus before we take a vote on this amendment that's been introduced.
Sure. Let's hear from everybody who wants to have something to say, and then we'll caucus. Very good. Okay. Luke, did you have something you wanted to add?
Yeah, I just have a question about the way this was phrased, because it discussed changing line BBB. And I'm just trying to understand exactly what that means, because so currently 3 million is being lapsed through the general fund out of the general assistance account. What is the intention of this particular amendment in relation to that?
Well, I think and it may not be necessary, but we had discussed whether it might be necessary to withhold the amount of money that this would cost, roughly 1.2 million, from that 3 million.
So it'd be 3 million minus 1.18.
I guess here's.
But it may not need to be done that way.
Doing that has an impact that doesn't have anything to do with this amendment. That's why I'm a little concerned. So I just want to make sure, because lapsing this money. So I think when this was being discussed, what Deputy Commissioner Mann noted was that currently I think the GA account had 14 million of funds from prior years. Of that 14 million, 3 million is being lapsed into the general fund, which is helping to balance the general fund. So if you change that 3 million lapsing number, what you're really doing is impacting the balance of the general fund. So I think the one option you have is to increase the amount that's being lapsed by the just under 1.2 million, which would then mean that the net impact of this particular bill in the biennium is zero, because you're paying for each year is 1.2 million or just under 1.2. So you'd need the total for each year. But by doing that, you would lapse additional funds, which would increase the general fund balance, which would pay for this amendment.
So that is an option?
That is an option based on the fact that the account does have additional funds that could be lapsed.
Okay. Well, we were going to deal with that separately after the amendment, obviously, determining how the amendment turned out.
is it an option to go ahead with BBB as written and then create a new amendment that mandates the spend of 1.12?
Yes, that you can do it that way, where you just vote BBB as is and add a new line to the budget, essentially a new language part that would lapse in additional funding to cover this amendment.
Mr. Mann?
That might be the most.
I'm not sure how the fiscal was generated. I know the department has not reviewed it. I would ask, I'm not sure how what the assumptions were included on that, or but I think it would be prudent for our review on that to make sure that the costs can be incurred, since there are additional COVID-related GA costs ongoing across the state right now in particular that may affect the carrying balance. And I would also, Luke is right in that you could offset the costs with an additional cut to the carrying balance to pay for the increase in GA in fiscal year 22 and fiscal year 23. However, if the amendment goes forward as proposed, you're permanently increasing the baseline costs in general fund, and you usually want sources and uses to align. So you would want to increase the baseline funding for GA to cover that change from 75 to 90%, not just one-time decrement from the carrying account. Although I obviously defer to the prerogative of the committee on that, but we would have a shortfall presumably in fiscal 24 if you didn't increase the baseline and increase the ongoing costs considerably from the 75 to the 90%.
Thank you. Representative Javner?
I apologize, Senator Claxton. Since this is a new amendment being brought forward, do we have to take the one piece off the table first in order to even bring an amendment into the situation? Or is that not the way that Robert's rules states?
I think the way it goes, if we're talking about a separate new line of amendment that is 1.12 million for the GA support, then that doesn't impact BBB, if that's what you're asking. If we're going to fund it that way, if we're going to fund it through BBB by increasing it that way, I think we would have to take it off the table. That's my sense of things, but I'm open to suggestions. That's why I think the allocation of 1.12 million as a separate line item is cleaner.
Right. So therefore, I would ask then perhaps, we could indulge, maybe Deputy Commissioner Mann would appreciate, the department to have a little bit more time to review, and I'm willing to be able to give that to them.
Okay, so we'll entertain a motion to table at some point, but let's get a couple other comments. Senator Moore.
That was going to be my comment, Senator Claxton. I'm feeling overwhelmed. I can't get my head around this whole thing, and between BBB and this amendment. And
okay.
So I would really like to have some additional time myself to even understand it thoroughly.
I think that's thoroughly appropriate. That's part of the reason I wanted to get the amendments out, so that we could think about what we were ready to deal with and what needed more information for tomorrow. So I don't see any other comments from the committee. Or yes, Luke, did you have something?
Well, I just wanted to speak to Deputy Commissioner Mann's question about where the actual numbers of 1.1 million came from, just under 1.2, sorry, came from. That's directly from the bill last year that did this exact change. So I do understand that there could very well be a difference between what that impact would be now as opposed to then. So I'll get in touch with Deputy Commissioner Mann about getting an updated impact on that.
Okay, Representative Craven.
Thank you, Mr. Chair. Chris Hasted has her hand up. Could we hear what she has to say, please?
We could. So Ms. Hasted, would you like to join us?
Thank you very much, Senator Claxton and Representative Meyer and members of the committee. My name is Chris Hasted. I work for Maine Equal Justice, and I appreciate the opportunity to say a word about this as it's a relatively new proposal. So we have no objection to the increase. In fact, we support it and have supported it in the past. The one thing we would like to ask you to consider if you're going to take this step is to also increase the department's capacity to oversee the program, the general assistance program itself. As the state makes a greater investment in this program, we would ask you to consider taking some steps to improve the long-standing problems that we've seen in the program that involve lack of uniformity throughout the state and failure to, in some cases, comply with the law, causing people to lose benefits that they should be eligible for. And we think the service centers do quite a good job in administering this program, and Senator Baldacci's General Assistance Administrators is one of the people I think does the best job. But I think one of the reasons that the service centers are so this is so costly to service centers is that many of the municipalities in the rest of the state don't provide the assistance that the law requires, and people often are sent to the service center municipalities. And if there were better oversight and enforcement of the GA law, we think that would go a long way to improving that chronic problem that we've seen, and I think many people that represent service centers have seen as well. So we would ask you to consider, in addition to what Senator Baldacci has proposed, also adding some staff to the department so that they can do a better job of adding to the unit they already have that audits this program, but do a much better job of sort of overseeing and enforcing the law throughout the state in a uniform way. Thank you very much.
Thank you. Ms. Broom.
I'm sorry. So when I drafted this, because of the way we draft under confidentiality, this was confidential, and I'm getting the sense that not everybody has it. Is that right? Do I need to send it to the committee? Because I got the sense that there was some confused looks from some of the Republicans. Do you all have that, or do you need me to send it?
I emailed it. Should have been emailed to everybody on the committee today.
Oh, okay.
So I think it would be, I think it would be helpful if you revisited. I'll rephrase that. Did you consider different ways to fund this initiative, including a separate line item versus an increase in the lapsing amount?
I think that I think it's correct that it would make more sense to have this a separate line item so that it's figured into the baseline of the budget.
Okay, so
I
can
think
you
that makes
work?
more sense. I mean, I guess the appropriations committee or whatever can figure out where the money should come from, but I think that it makes sense to have this as a separate line item, so it's figured into the baseline.
Okay, so Anna, can you craft language to do that or deal with that?
Mr. Chair, I'll just note that is how it is currently drafted. Is there is a new appropriation going to the GA account for the 1.1 million, which would be in the baseline. The only thing that wasn't drafted was how to fund it piece, which at this point sounds like it's the idea of having an additional lapsed amount that will account for the total of the biennium that would be needed.
Okay.
Mr. Chairman, may
Yes.
I just say one thing?
Yes, Senator
Just
Bowman.
in response to Chris's comments, I don't disagree with them at all. I think that she's correct. My concern, I think what she's essentially saying, because it is the law and every municipality is supposed to comply with it, that basically, I think she wants to see more uniform application of it by all municipalities. And that is a great idea. I'm just not sure. What I'm trying to seek is a measure of relief for property taxpayers in communities that are shouldering the burden now. So I think that they're both important issues. I'm just not sure if I would combine the two issues. I think the staff issue and the structure of the program really needs its own separate conversation. But this issue is pretty straightforward about the burden of the ongoing costs. So,
Okay.
thank you, Mr. Chairman.
So at this point, it looks like we've heard everybody in the committee and our resources. So I will entertain a motion to table this until tomorrow, when we will reconsider it and BBB at the same time.
So moved.
Second.
And a second. Okay, Carrie, can you run the tally? And we've lost one of our members to a internet crash. Go ahead.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes, we're voting to table, correct?
We are. I'm sorry, I should have repeated that. Thank you, Representative.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Looks like we've lost her too.
Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. And Representative Griffin, you froze for a moment.
Okay.
And you're muted.
Yeah.
Yes, Representative Griffin, yes, thank you. And
Representative Zager.
Thank you, Mr. Chair. Please forgive me my internet difficulties. If the chair might summarize the vote.
What we're voting on is a motion to table Senator Baldacci's amendment to increase the percentage covered by the state for general assistance.
Yes.
Representative Zager, yes.
Weren't we also tabling BBB as well? Or leaving
Well,
BBB tabled?
BBB is still on the table.
Okay, so we're just leaving it on the table. Okay,
Yeah.
gotcha.
Okay. So we do have EEE to do also, but in the interest of at least getting the other amendments on the table, I'd like to hear from Holly, and I think Representative Craven has another one, but Representative Stover, would you like to present your amendment?
Yes. Thank you, Senator. I don't have the line item. I apologize. I'd like to make an amendment to the biennial budget regarding the Alternative Response Program, ARP, which we have discussed at length in our committee. And some of the concerns that have been expressed is the transition from the ARP program to the additional 15 casework positions. And I want to make an amendment that we continue with the 15 caseworker positions, but in the interim, that there's a continued plan to transition as the Families First model gets into place on or after October 1st when the awards are made. But we propose this transition plan in order to reduce or decrease the risks to families during this period of time. As Dr. Landry had discussed with us, part of the plan for Families First is to move the child abuse investigations from ARP to DHHS, and I certainly want to continue to support that. But would suggest that as part of the transition that OCFS continue to refer families to the Alternative Response Program after that investigation by the state OCFS caseworkers to support the families with information, resources, and other needed services, and also monitoring for ongoing safety concerns as the other program, being the 15 increased positions in Family First, ramps up. And this would conclude at the end of this calendar year, December 31st, 2021. And at the conclusion, to offer a severance package for up to 2 months to those alternative response workers who stay with the program through the end of the calendar year. And the fiscal note on this amendment would be $500,000. And what it would do is sort of create a bridge between what we have now and what's coming into place, and allow adequate time and resources to be put into place to keep that safety net intact for families in Maine. Thank you.
And did you worked with whom on putting that amendment together?
I worked with Anna
Yeah.
and Representative Madigan and Representative Craven.
Okay. Is there anything else? Okay, so the option of this, well, let's hear all of the amendments for right now. And it's been pointed out, yes, Representative Perry.
Thank you. I would sort of like to hear from Molly about this, and maybe the department tomorrow.
Go ahead. Ms. Bogart, do you have some follow-up to that thinking?
Sure, I would I'd love to see the amendment and share it with Dr. Landry. I think there's certainly significant planning that's gone into our transition from his perspective. So I'd love to get his thoughts and share them with you tomorrow.
And as has been pointed out to me, I was a little premature in saying that we're got to be done by noon tomorrow. That's arbitrary and capricious. We really have until the end of next week, not the end of this week, to get the information to appropriations. So thank you, Chair Meyer, for pointing that out to me. I just have been aware of people breathing down my neck and wanted to respect our need to get things to AFA. So we aren't limited by noon tomorrow. If we can get some of that information, fine. If we can't, we can carry it over into the next week as a work session. We'll carve out some additional time. So bear with me. All right. So we want to get the amendment to Molly so she and the department can spend some time with it, and you don't need to get to us necessarily by 8 o'clock tomorrow morning. Okay. And as far as Representative Chavner, you'd asked about a tabling motion, or you'd asked, yeah, about a caucus, and I assume the tabling motion met that need. Is that right? Okay, just wanted to be clear. Didn't want to ignore the request. All right, so is there a second amendment that you want to bring up, Representative Stover?
Yes, if you could just give me, again, I haven't discussed the second amendment with Molly, so we might want to table that until tomorrow, so I have an opportunity to discuss that with her as well. With my apologies, thank you.
Well, I don't think you need to apologize. We have more time than we thought we did, than I thought we did. So we'll be deliberate about this and not rush to things. So you'll have another amendment, and in the meantime, you'll be talking to Molly about how it's going to work. And did you spend some time with Luke and begin to fashion a fiscal note? Okay,
yes.
Good. I think there's also another amendment coming from Representative Craven.
Thank you, Mr. Chair. There is, and mine pertains to line item 453 in the green paper. This request really came from the Maine Affordable Housing Coalition, and of course my own parochial sensitivity to Lewiston supports it, because we have really an enormous lead problem here in our older housing stock. So I did actually email this to everybody on Saturday or Sunday, whenever I got it, but I'll read it. It continues 5 limited period environmental specialists, 3 positions previously continued in Public Law 2019, Chapter 343, and 3 limited period environmental specialists 3 positions previously established in Public Law 2019, Chapter 343, and provides funding for related all other costs. Also provides all other funding for the continuation of lead inspection services and associated laboratory costs. These positions will end, that end now in 2023 would end in 2027.
So your amendment is to extend the position duration beyond June 17, 2023 to a similar date in 2027.
Yeah, the concern is that these are highly skilled people and that there's been vacancies in this department, and they would like them filled, and they think that would be better, you know, that it just would be more probable to get those positions filled if there was more security, and people could see that their positions was lasting, you know, for a longer time.
So you've had a conversation with the department about this bill?
No.
Okay. Representative Perry?
The only question I ask is, and I think this maybe Mr. Mann or Luke could give us, is can the state do temporary positions that go beyond the biennial budget?
Go for it, Luke. So I do think that you still can do the limited period positions beyond the current budget. They're still limited in a time frame, but it just has been the ongoing practice to keep it in the biennium. That's every limited period position I've seen that has come through has always been done biennium to biennium.
My understanding, that's also my understanding, is that they're typically 2 years and that you can't commit and prejudge the future legislature's prerogative, but I'm happy to research that a little bit.
It sounds like that's worth being researched, and also the issue of whether these are the right people for the work that Representative Moore envisions. I just want to make sure that if we extend a hire, it's for the people who are going to be most helpful in addressing the lead issues. So we'll defer to the department on that one, start that conversation.
Right, to that point, I think the line item is 447. I'm not sure if that is what Representative Craven mentioned.
Mentioned 453.
453 are state lab positions. 447 are the 8 positions related, environmental specialists related to lead work.
Okay. So Representative Craven, with the newly expanded time available, could you get with Molly and help sort out whether these are the people that CDC wants to extend and how they feel about that idea?
Okay, will do.
All right. So are there any other amendments to come forward that at this point?
Senator Claxton, I also have an amendment that I will be discussing with the department. I've worked with Ms. Broom and Luke Lazur, and my amendment would increase the Fund for Healthy Maine allocation by $5 million annually in the Maine CDC to maintain the tobacco prevention and cessation interventions. So I will work with Molly on this over the next few days.
Great. Thank you. Anything else? Any other amendments? Okay, I don't see any. I'll turn to our analysts at this point for indication whether there's other work to be done.
I don't know if anybody has a report or anybody is in the mood for a report. but I don't have anything else.
Thank you for not speaking up, because it's time, I think, to move on. So we heard from Anna. Aaron's not with us. Are we all set then, Carrie, as far as you're concerned?
I have to point out that Erin is sitting right below you on my screen.
Oh, there she is. There she is. Erin, sorry, I missed you. Yes, that's evidence that I need to quit anyway. I don't know about the rest of you all. Okay, so nothing we need to do as far as Erin's concerned. And we can thank the people who are no longer in the waiting room for their contributions. And yes, Representative Javner.
Thank you, Senator Claxton. I just need to register a vote while I was offline for lines 343 to 346 with Anna, and my vote would be yes.
Did you get that, Carrie?
Oh, I apologize. I thought it was.
No, you're correct. Anna and Aaron will keep track of that.
Sorry, what were the lines, Representative? Just tell me again.
343 to 346.
Yep. Thank you.
Yes, I thank you again. All right. As long as your hand's up, Representative Javner, did you want to propose that we adjourn until we start up tomorrow morning?
I will make that motion. However, I do mention that I do have a report ready, but I am not in the mood. Make a motion to adjourn, please.
Second the motion.
I second the motion to adjourn.
I second the motion. That's right. Okay.
What time
All
are we
those in
starting?
favor of adjourning and not hearing Representative Javner's report today?
What time are we adjourning in the morning or starting in the morning?
I don't know when we're adjourning.
9 a.m.
9 a.m. Thank you. I meant,
This is 9 a.m.
that tells you how tired I am. You know, I'm already calling tomorrow off. No, 9 a.m.
All right.
Thank you.
All right. See you tomorrow at 9 o'clock. Thank you all for